Thoracic outlet syndrome is a fairly uncommon cause of shoulder pain, upper extremity pain, numbness, tingling, and weakness. You mainly hear about it among Major League Baseball pitchers or throwing athletes, but I do discuss how it potentially comes about in a military veteran in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help military veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Thoracic outlet syndrome is a diagnosis, and it represents a number of different conditions, but it's basically compression of the nerves and blood vessels that pass through the thoracic outlet, basically sort of toward your armpit. It's sort of surrounded by the first rib, the scalene muscles, and the clavicle, the collarbone, that makes up the boundaries of the thoracic outlet. And there's different types of thoracic outlet. There's the type that involves congestion of the vein, congestion of the artery. There's traumatic version. There's nerve thoracic outlet syndrome. All of these are sort of different subtypes of thoracic outlet syndrome. And that's why there's a wide range of symptoms. It can be sort of a minor complaint to a very debilitating set of symptoms and very debilitating to somebody's way of life and work. It manifests again when there's pressure in that thoracic outlet to the point that it's putting pressure on the blood vessels and nerves in that area. And again, it can be from anatomic abnormalities like a thoracic rib or space occupying lesion like a tumor or cyst. It can be due to fibrous muscle bands that develop due to overuse, which is what in the few veterans that have reached out to me, a lot of times that's what it is from overuse. It can even be related to past trauma. And so that's where it can be really difficult. But for military veterans with overuse, you could very logically argue that it was caused by military service. Diagnosing it is tricky. There's physical exam for sure. After physical exam, then it's more advanced imaging testing, chest x-ray, cervical spine x-ray, more often than not looking for other causes, but also looking for anatomical causes like a rib putting pressure in that area. Ultrasound can show you venous thoracic outlet syndrome. Angiograms can potentially show arterial thoracic outlet syndromes, and electrodiagnostic studies, nerve conduction studies, EMGs can help diagnose the nerve-related versions. Treatment, there's conservative and then there's surgical. And you typically, as with anything, typically start with non-surgical treatments to try to get it to heal without any kind of surgery. And again, how that goes really depends on how severe the symptoms are, but things like lifestyle modifications, physical therapy, and rehabilitation. But if it's severe compromise of the blood vessels or nerves in that area, there can be atrophy of the muscles in the hand. Surgery is often the recommended approach. From a disability claim standpoint, what I think most military veterans care about is, could you argue thoracic outlet syndrome was caused by the military? And if you did a lot of overuse, especially overhead activities, a lot of use of your arms, potentially maybe lifting heavy weights on a repeated basis overhead, that's where potentially you could argue it as primarily caused by military service. Now, if you're interested in learning more about the disability claims process, you can get a free copy of my ebook, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Them. You can get it absolutely free. Just click the link in the description below this video. Also, if you're interested in a Nexus letter for your injury or condition, you can click that same link, scroll further down, you can learn more about working with me and working with my team. We try to make the process simple, we try to make it quick, and I really try hard to write a Nexus letter that does the best it can to try to help you win your claim, so hopefully you can get the compensation you deserve. Thank you so much for watching, and I look forward to working with you.